Welcome to the Starting Nowhere podcast. I'm your host, Brandon. Do me a favor and make sure that you hit like and subscribe if you haven't already. Today, my guest is Kevin McFarlane. Kevin is a longtime emergency nurse who was one of the first vaccine recipients in Texas for the coronavirus. Please enjoy today's episode. Well, thank you very much for joining me today, Mr. Kevin. Why don't you go ahead and tell everybody a little bit about yourself?
Hey, everybody, I'm Kevin McFarlane, and I am the host of a podcast called The Art of Emergency Nursing. I am an ER nurse. I've been an ER nurse for about 15 years. I've been working in emergency services for about 20. Backgrounds mostly in the emergency department. Before that, did some kind of odd jobs here and there, but I found my passion with ER and then became an emergency nurse and became a leader and an educator and do all that kind of fun stuff. And now I get to hang out and teach emergency nursing to a whole new group of nurses.
So let's start there because that's a question that I have had because when we first started talking, I saw you say that you were an emergency nurse, and I'm like, what exactly is an emergency nurse? You know, when I think of nursing, I think of a generalist, or something like that. I
Yep.
don't think of emergency nursing. So how does that differ?
So it differs in that, so for every department in the hospital, everyone has their specialty. So, and the emergency department is no exception. So emergency nurses are those that are going to take that first patient contact right when the patient comes into the hospital. Typically, they come in through the emergency department. When they come in through the emergency department, whether it's for a boo-boo or a major trauma, the emergency nurses are going to be there to care for them, stabilize them, and get them ready to either be admitted to the hospital or be discharged home. So it's its own specialty in nursing, and it's kind of the place for kind of the adrenaline junkies and the people who like a high speed environment and want to just kind of see people and just kind of cycle them through.
So, just to put it into movie and TV show terms, because that's how I see the world, you would be one of those people who, whenever somebody busts through the doors in a show, when they're first, you're one of the nurses that's on the side there
Yep,
helping them come into there and talking to maybe the EMT and everybody that's trying to find out what's
absolutely.
going on.
Yep, absolutely. And
Nice.
been doing it for about been doing it for about 20 years. Been a nurse for 15, been in the emergency department, gosh, now more than 20. I found my home. I was lucky enough to find my fit when I first applied for a job in the emergency department, and I never looked back. I just decided that this was going to be my thing. This was what I was going to do. And boy, it's been a hoot. It's been so much fun. I still enjoy it.
Well, that's outstanding. Well, first of all, thank you. I always like to say that to people who do what you do or who do anything to really provide service to the world in that type of way, because without people like you, the world could get a lot grimmer and the mortality rates would certainly go up. So, first of all, start there. Thank you very much.
Well, thank you
So,
so much. It's a pleasure to be able to do it.
absolutely. So, tell me a little bit about the experiences that you've had in the emergency room. Just do you have a go-to crazy story that you like to tell, or just what some of the things you've seen
Oh
there?
gosh. Yeah. So I've seen it all. I tell people I've seen it all, and I worked at one hospital for about 18 years. I worked in the emergency department for 18 years. It was a busy, what they call a level one trauma center, which is the big bad, usually the big bad academic medical centers, where if you get hurt, shot, car accident, whatever the case may be, whatever that trauma may be, there's the what's called the level one trauma center, which is the first place you're going to go to if there's one nearby. And worked there for 18 years, seen it all, done it all, seen so many things, good, bad, everything in between. And it was my last week there. I was getting ready to take another position. It was my last week there, and we were kind of joking around, going, "Hey, what haven't you seen in the last 20 years in this 18 years in this department?" And boy, I was kind of hard pressed to come up with something. I was kind of hard pressed to come up with something I hadn't seen. And then sure enough, the pager goes off, and the hospitals, I think they're the people still keeping the pager companies in business. The pager comes up, and the pager says, "Woman attacked by bear." And I was like, okay, now that I haven't seen. I was like, well, there you go. You asked for something I haven't seen. Here's something I haven't seen. I've never seen a woman attacked by a bear. Sure enough, a few minutes later, this woman comes rolling in. She was running a marathon, and she got to a place in the marathon where she was kind of all by herself, and she kind of comes up over this hill and she sees this little baby bear cub, and she's like, oh gosh, and turns around and there's mama bear, and mama bear took a swat at her, and took a pretty good swat at her. And sure enough, she came into the hospital, and we got a chance to take care of her, took good care of her, got her stabilized, got her taken care of. But I said, okay, now this is something I hadn't seen. So, but before that, it had been a while since I had seen something I hadn't seen. I think, the other, my other kind of go-to story is, you see, you hear a million things about black widows, but I've never seen a black widow bite until, I don't know, maybe about 6 months before I left that other hospital. And, it was the first time I actually seen a confirmed black widow bite, which I was like, it's kind of exciting. So,
I can't imagine it was exciting for the person who got bit, though.
no, well, it's kind of funny. She was an older woman, and she was just hilarious. She comes in, she brought in the spider. She brought in the dead spider. She picked it up, brought it in. She's like, "Here's the sucker that bit me." And we're like, "Okay, we didn't need that, but okay." And we had a couple traumas coming in at the same time, and everybody was really excited to go see the traumas. And I was like, you guys can do the traumas. I've seen plenty of those. I want to go take care of the spider bite because that seems kind of interesting. I hadn't done that. And that to me is kind of the interesting stuff. As I was younger, I was really, really jazzed on the trauma and the car accidents and the gunshot wounds, and you take care of all that stuff. You see the absolute worst in humanity, but you also see the best in humanity as well. And I got to the point where I was like, oh, okay, I'm kind of done with this. I'd rather be that guy that, sitting at the bedside holding a woman's hand as she's, telling me a story about what brought her there. That's kind of more of the thing that really kind of gets me excited about being a nurse, is just being there to take care of folks.
And I think that's one of the things that we don't commonly think of when it comes to nursing. You think about all the medical training, you think about obviously the scrubs and all the little cliche things that go along with nursing, but I don't think you
Yep.
think about the almost therapist role sometimes, or comforting role that nurses provide for a lot of people.
Absolutely. I mean, there certainly is that. I think, one of the things I do more kind of an education role now. And one of the things I always tell people when I'm teaching is, one of the skills you'll use every single time with every single patient is your communication skills, because we're constantly talking to people.
So, how do you manage that? Because I know for some people who are empaths, they can tend to wear that emotion of, people being on death's door, or people
Yeah.
who they couldn't save, or whatever it is. How do you manage those emotions as you see people, like you said, some of the worst stuff you see in humanity, and not everybody's going to make it out of that, unfortunately. How do you handle that?
I think that that's something that every nurse has to face at some point, because you're not going to save everybody, for instance. And it's hard. I mean, you take every loss to heart, everyone that you lose, everyone that you weren't able to do exactly what you wanted to do. You feel that. And there's a lot of very empathic people in nursing. But what you learn to do is you learn to look at the kind of the end game, and knowing that, by the time your career is done, you're going to touch a million lives, and you're going to touch a million lives. And in days that I always tell people, like, what for our patients is a life changing, life altering day, to us is Tuesday. We're just like, this is
Mhm.
just every other Tuesday, not a big deal. And the difference there sometimes, I always have to remind people that what to you is just an everyday thing to you is not a big emergency. To the patient in front of you may be, life changing, maybe life altering news. And I think if you remember that, and take that with the grace that deserves, I think that'll take you a long way.
That's awesome. So I imagine, maybe not for you personally, because obviously you've been doing it for a while now, so you seem to have the coping mechanisms necessary to do that. But I imagine you've seen some people who definitely have gotten burned out from that, or just the trauma has gotten to them, and they internalize it a bit much. So when you are talking about telling them that what may be routine for you, uh, m- maybe somebody's a life changing event. What about the opposite of that? And kind of how do you tell them to balance that out with what is a life changing event for them should not be one for you necessarily?
Absolutely. I think you have to have that role. You have to be able to separate yourself just enough that you can still, one of the things that I have a good friend that always says, that nursing is a very relational. business, and it really is. It's all about building trust with strangers so that they're going to tell you their deepest, darkest secrets. I mean, someone will come in and sit down in the chair, sit down in the bed, and start telling you things that they wouldn't tell anyone else. So it is a very relational business, but you need to be able to kind of put on a little bit of a shell, because you can't go home and cry over, every single thing. And certainly if you get to the point where you don't feel it anymore, it may be time for something else to do. Um, but certainly, I think a lot of people realize pretty early on that burnout in nursing is real, and burnout in emergency nursing is as real as it can possibly be. It happens. They say most emergency nurses last about 5 to 10 years in that role, and then they're going to go on and do something else, or they find themselves to the point where they just don't feel the same passion for it, or they seem a little cold towards patients.
Mm.
And I've been lucky, I've been blessed that I've never felt that way. Like, I've always found the little wins, like the cool little things that kind of make your day, and the things that make you go, okay, I can come back and do this for another 12 hours. Um, but it's hard because sometimes you got to come home and you got to kind of try to forget about stuff. And sometimes you do, and sometimes you don't. I mean, every ER nurse I know has some old ghosts that there's a couple hundred patients that you'll never forget. And sometimes those are good experiences, and sometimes they're not.
And
So
so, and I think what you're talking about there might be that people need some kind of intrinsic motivator to carry them through those tough times.
I think having an intrinsic motivator really makes a big difference. And then I think you got to be mentally strong. If you're not mentally strong, you're not going to make a very good ER nurse, because every little thing will just make you want to crumble. You have to be strong enough to be able to um, be there, but strong enough to be able to say, okay, I'm going to keep this separation between me and you. And one of the things I'll tell people all the time is you got to have a good support system, and you got to have like things outside of work that bring you passion, things outside
Mhm.
of work that make you feel good.
And I mean, I think a lot of the things you're saying is the same things that I've heard people tell to police officers, they tell to
Absolutely.
military members,
Mhm.
because trauma, even though it can come in many forms, I think the way we deal with it is relatively similar. And so
Right.
I don't think, like I said before at the beginning of this, I don't think a lot of times you think about the nurses when you think about the trauma that people go through and everything, especially because until recently, when we watch TV shows, where we watch other representations of what the ER is, it's always from a doctor's point of view. It's always from the surgeon's
Yeah.
point of
A lot
view,
of
all that
times.
type of
Yeah.
stuff. And we always pretend like there aren't, if I'm not mistaken, nurses outnumber doctors, correct?
By far. And
Yeah.
if you think about it, one of the things I always joke is, if you think about your average patient care, um, the nurse is going to spend 12 hours with that patient for, let's just say, inpatient. An inpatient nurse will spend 12 hours caring for that patient. And granted, they're caring for them and a few other people. So they may be kind of in and out. But when you compare that to the time that a doctor is actually going to spend with the patient, it's a fraction of that time.
Hmm.
Doctors will come in, they'll come in, they'll evaluate the patient, see the patient, and then get out and write some orders, do whatever they got to do. But really, the nurses get to be the eyes and the ears, and they get to be that face of healthcare, more so than physicians by far. And there are certainly outnumber physicians by far as well. So
Yeah. And like I said, I'm glad that we're starting to see that recognition. I'm glad that we're starting to turn the page, as it were, on what we expect from our healthcare professionals and who we value. Because I've seen more and more, maybe with the rise of social media, because there's so many nurses who are on social media and those type of things.
yeah,
But I'm seeing them getting a lot more recognition, and I think that's a great thing, because they've been unsung heroes for so many years. And I think Scrubs was the show that saw it. I didn't particularly watch Scrubs, but there was an episode where the female character, I don't remember, like I said, I don't know any of their names really, the female
yeah,
character who was a nurse, and somebody basically made some comment about her just being a nurse, and they were like a doctor or something like that. And then they went into that whole thing about how long she's been doing this job, you're
yeah.
brand new, and like all this stuff, and she, how many people she's helped and saved and what she does, and like to not respect her as a doctor. it makes it that much worse. And so I think that opened my eyes a little bit to it. And then now, like I said, now that I'm a little bit older, I know personally quite a few nurses. I know a lot of people who've been in the nursing field, and even some of my family wants to get into it as well. And like I said, it's one of those rare jobs that does not require you to either A, be selfish or not help people to do it, and B, it also has some good financial incentives for doing it. It's not a terrible job.
Oh, I got to tell you, I recommend nursing for anyone who asks. I always tell people nursing is a great career. Nursing is a great career to get into. I think for guys, particularly, I think for guys, not enough guys get into nursing, and it's too bad because it's a great career. The idea that you can at a lot of these jobs work 3 days a week and have your work week done, that's amazing. You're always going to make pretty good money. That's amazing. I mean, there's a lot of really good things, and I always tell people all the time, I'm like, if you're not sure what to do, and if you think you could do this work, then boy, it's a great gig. So
Exactly, especially in this day and age when some jobs are being lost to automation, some jobs are being outsourced, some jobs just in general jobs have a lot of turnover these days. Nursing's not going anywhere. Robots can't
yeah,
do it. You're never going to have a
no,
shortage. There's always going to be nurses and doctors needed, particularly, like I said, nurses, because how much they outnumber doctors. That
yeah,
number can never even up, or we're going to be in a lot of trouble.
yeah. No, it's going to be, there's definitely job security in becoming a nurse for sure.
Yeah, and
Just great. It's good for me. It's great news for me.
yeah, because like you said, people are always going to need that help. That's never going to go away. No matter what system we go to, no matter what health insurance you have, whatever else, you're going to need somebody to come and help you, and you're going to want them to have a nurse for sure.
One of the things I've been blessed to be able to do is through my podcast and just through my network, I've been able to meet with and visit with nurses from all over the world. And you find that nursing is nursing no matter where you are. So if you're in, I have a friend in Norway, and nursing in Norway is exactly like it is in Germany, is exactly like it is in Africa. It's all pretty much the same. There may be some minor variations, but boy, for the most part, the taking care of the sick and injured is it's kind of the same. So
And I always love to hear things like that because I've done a little bit of traveling myself, not very much at all by any means, but I've noticed that as well. There's a lot of things that connect us to people across the world, and the way that we do things, and what we not specifically what we believe in, but what we believe makes a happy life, and what we want for our families, and all those type of things. Because I think too often we look at each other, and that's such a different world over there. I don't know how they do it. And like, well, they care for their family, they want to be healthy, they're like all the same things that we want. And so jobs even specifically become the same way. You're working with somebody who's a nurse from Norway, like you said, you're going to see there's a lot of similarities, some differences because of the systems maybe, but at the heart it's the same job.
absolutely. And I mean, the thing is we're all people, right?
Mm.
And we have a lot more in common than we do apart, which is, always a nice thing. And, social media has brought our world so much closer in that I can have a conversation. I can have a conversation like we're having a conversation now with someone across the world where, 30 years ago, that may not have been possible.
Yeah,
So,
not without knowing Morse code or something like that.
right. Yeah.
uh,
exactly.
yeah,
Exactly.
small exaggeration there because 30 years ago isn't that long ago, but it's always
I
fun to say
know.
things like that. 'Cause that's how it
it's
feels
true.
with the technological revolution we've seen in our lifetime. That's sometimes what it feels like. Because, like I said,
It's,
I remember getting on the internet and have to be screamed at by my computer. That
oh,
was a thing that used to
yeah.
happen.
Yeah. When you tell people, boy, this is, you'd have to wait for, I remember waiting for a long time to just connect to the internet because it was too busy.
Yeah.
like you couldn't even imagine that now.
And imagine Instagram or any of the more picture based mediums
Oh,
on
oh, forget it.
56K modems when you would get like a line of the photo at a time and it was
Yeah.
going like this. Oh man, I don't. You'd really see who cares about your photos then if they're sticking around for that to like it.
Brandon, you're making me feel old, man. You're making me feel old.
I was telling you that's what the craziest part of this is. It was
it's
so
it's
recent.
true.
It was so recent. Like this is I was in
It's
high
in our
school when that was
lifetime.
happening.
Yep. It's in our lifetime for sure.
So, with you doing a lot of the emergency nursing and stuff, how has this past year been for you? Have you seen the uptick of patients where you've been at due to COVID, due to, let's say, other injuries and things like that, and having to maybe, I don't want to say reject, but handle patients in a different way because of the influx of COVID cases and things like that?
Yeah, it's kind of funny, and many people outside of nursing don't realize this, but 2020 was supposed to be the year of the nurse.
Oh, it was.
And it was, and that they were real busy.
Mm-hmm.
We've certainly seen an uptick in patient loads. We've seen an uptick in one of the things that I think probably sits with me the most when I think about just exactly what has been the impact of COVID-19 on healthcare
Mm-hmm.
is when you look at the number of people that have died from COVID-19 and you'll hear people kind of challenge that number and say, well, they're going to die of something, right? And sure, that's true. But one of the things that we've seen with COVID is younger people, younger, what were thought to be previously healthy, those kinds of people were dying. And that placed a pretty significant emotional burden on nurses all over the world because they were suddenly taking care of these patients who under normal circumstances wouldn't die or wouldn't be as critically ill as they are. But boy, the COVID-19 has certainly caused a ripple in healthcare. And one of the things I think, one of the things that has made it harder than anything else is that COVID's kind of like an invisible threat.
Mm-hmm.
You can have COVID, not have any symptoms, and still be spreading COVID and have no idea. So for the first time, and many of the nurses that I've worked with, that I work with now, and the first time in their careers, they were feeling like they were a burden to their family because they had the possibility of bringing this stuff home,
Mm-hmm.
and that's unlike anything we've dealt with before now. Emergency nurses deal with stuff. They deal with bad stuff. Anything from gunshot wounds, aggressive and violent patients. Um, Narcotic overdoses, whatever the case may be, we deal with it all. But one of the things that really kind of stuck is how critical these folks suddenly were. They were so sick, and that was a big change and a big uptick from what we've previously, from the numbers we previously dealt with.
And that's a sad thing to see. One, because I know what your job was already difficult,
Yep.
and to have that influx of patients, and then also to worry about your own personal health and your family and everything like
Yeah.
that. So I know for a lot of people that was a very difficult thing to deal with, and then to make matters worse, you have the way that the politicians reacted to it, the way that both, again, for and against, because I do think that there is a lot of blame to go around for the ways that a lot of this stuff went down.
Yeah.
And I think that what you see there is a critical field like nursing, a critical field like medical care in general, did not receive the support it needed, did not receive the equipment it needed. A lot of the PPE was so scarce that people were having to reuse single use items and all those type of things. And it's one of those things that makes you concerned because, again, relatively speaking, this is all, everything's relative, right? Relatively speaking, COVID-19 does have a low mortality rate compared to, say, something like bubonic plague or
Of
whatever. Well,
course.
not bubonic plague. I always go to that reference, and I've actually been told like bubonic plague is very low these days. But
Yeah.
I meant to say Ebola. Sorry,
Yeah.
Ebola or something like that. But it still has high enough of one that it was a concern. So what do we do if we get something that has a higher mortality rate? What happens then? If we
It-
don't have nurses with the proper PPE, because we can't trade off nurses for patients, because that's
yeah.
going to cause a
Yeah.
big problem very quickly.
Yeah. That's not super sustainable. We were lucky in that as bad as COVID has been, and don't get me wrong, it's bad and it's certainly an issue. But as bad as it has been, um, it could have been 100 times worse. It could have been a
Mm-hmm.
lot worse. And our saving grace is that it wasn't. And so many people were getting COVID-19 and having either very minor or very mild symptoms. Um, but others were like becoming gravely ill from it. And it's kind of a crapshoot because you don't know which way it's going to go. You don't know if it's, is this someone who's going to be very, very ill, or is this someone who's going to probably be okay?
Mm-hmm. And I think the thing for me that I don't know what happens next, because is this going to solidify for some people that we don't need government restrictions, we don't need other stopping measures for when we do have something that has a higher mortality rate? Or is this going to be enough to say, hey, we don't want that to happen again, we need to take this seriously quickly? I don't know which way we're going to go, and I could see either reaction being the case. And I always compare it to hurricanes in Florida. You have some people who go through a hurricane. It's like, wow, we got really lucky. We need to worry about the next one. We got other ones. Well, we've survived 5 of them now. We don't have to worry. And you never know
Yeah.
which way people are going to be. And in one day, a hurricane, or in this case, a pandemic, a virus that causes a pandemic, or a bacteria, or whatever it is, one day there will be one that does cause it. And that's why I started off this pandemic as foolishly as it sounds, just because it's funny to me. And I think it was one of my coping mechanisms, saying we'd have no chance in any zombie outbreak. No matter what I used
Yeah.
to think was true, Walking Dead is the most unbelievable part of Walking Dead is that people took zombies seriously.
Yeah. It's a good point. It's a really good point. Because you're right. I mean, so many people just didn't take it seriously, and it became such a politically polarizing um, thing, in that it became very political, which was kind of surprising to us, and still to this day. I mean, there's still people who think that the whole COVID-19 thing is just not as big a deal as it is, and I'm here to tell you, spend a day in the ICU, and you're going to know that COVID is a big deal, and it is still affecting people, and it's still a problem.
And one of the things that I think naturally leads us into the next topic that I wanted to get into as well is that what we've started to see is through the disinformation and the just political manipulation of what's happening with COVID and stuff, we're now seeing people who have the same disregard for the vaccines. We went from only a few years ago laughing at Jenny McCarthy, laughing at all these anti-vaxxers who were, causing these measles outbreaks and all these things, to now we have a significant portion of the population who is concerned about the COVID-19 vaccine. So I have it on good authority that you yourself have received said COVID-19 vaccine. I believe the Pfizer version. And
I,
I want to ask you a question because I'm not seeing any horns. I haven't seen your tail. Are you hiding it? Like where's all the side effects?
I was really hoping for a tail. That didn't work out. No, I was. So the day that the day the Pfizer vaccine was released to the public, and first day that our hospitals in Texas were giving the vaccine, I got vaccinated. And to me, it was a no-brainer choice. It was an easy choice to make. Um, I looked at, as a nurse, I like to think of myself as a bit of a scientist. We follow scientific reason. We follow science. Nursing's all about science. Whether there's the caring piece, but then there's the science piece of the care that we actually give. And I kind of consider myself a little bit of a scientist, in that I looked at the risk of getting COVID versus the risk of getting a vaccine. Now, you're absolutely right. You know, a year ago, we were kind of shaming people who were anti-vaxxers and shaming people who didn't want to get a vaccine. Now you have nurses across the country that are actually saying, I'm just going to wait a little while before I get that vaccine. And I got to think to myself, why? What are you waiting for? And I think there's a lot of concern. I think it became a little bit of a political issue, is certainly part of it.
Mhm.
Um, but there's so much caution and distrust around the vaccine that maybe is not as justified as maybe we think it is. Very a lot of people were very cautious with the vaccine, because they're thinking to themselves, "Wow, look how fast this happened. Look how fast we went from having this disease to boom, we got a vaccine." Um, and the reality is, there's pretty good explanations for that. I mean, this vaccine, well, being a new vaccine, or this disease being a new virus, is new, but it's a lot like a lot of viruses we already know. It's a lot like the common cold. It's a lot like the flu. It's a lot like SARS, um, the respiratory disease that we've been working on forever. Um, so it's a lot like all of those. So we knew a lot about it, just kind of going forward, just based on that. But we very quickly had the genetic code for SARS really figured out. I mean, China figured it out, sent it out, said, "Hey, here's what we've sequenced the virus, and here's what it looks like." And it gave opportunity for a lot of different companies to start working on a vaccine right away, because it became clear to everybody, we are going to need it. We're going to need a vaccine for this virus, and that's exactly what happened.
So one point of clarification, because I believe I know what you're saying, but I just want to clarify to make sure that I do, and that anybody listening gets that as well. When you say that it's similar to the common cold, to the flu, and to SARS, you mean the virus itself, not the side
Correct.
effects, not the mortality,
Yeah, not
just the
the yeah,
virus
yeah,
itself.
no, just the virus itself. I mean, as far as, what it does and the reaction your body has to it, not like not like a common cold, not like a lot like the flu. Um, but certainly, if you think about the flu, the people who get the flu vaccine typically tend to be the medically frail and the old. They're the ones who really it's really important to get vaccinated against the flu because they're going to be affected the most. What we found with COVID-19 is while that's still true and those people are highly affected, you know, young, otherwise healthy or young, mostly healthy folks were having significant impact with COVID as well. And that makes it hard. It makes it a completely different animal.
Mhm. Gotcha.
But so while the treatment is well the treatment while the genetic makeup is very similar, what it does to our body is very different from some of those other programs we mentioned.
Gotcha. And so I think that's the thing that's been interesting to me because where we saw politically uh, two separate sides of that issue, one pro, restricting behaviors to try to control the spread, one saying that this was serious, and the other side saying it wasn't. What I found interesting was that there were people who were taking COVID-19 seriously that were still anti COVID-19 vaccine that won't get it, that aren't planning
Yeah,
to get it. And one of the numbers, excuse me, one of the things I've seen recently that was surprising to me, and you kind of touched on it a little bit, is that the medical professionals who are, like you said, they rely on science, they work in it every day, and these type of things are about equally to the general populace, are equally reluctant to get the vaccine. And so,
yeah,
what have you experienced any of that personally? Some of the people you know, without outing anybody, not necessarily that you work with. It maybe you said you're on
absolutely.
nursing communities around the world,
Yeah.
but have you seen any of those conversations and kind of what's their thought process? What's the hesitancy to do it? Is it still the how quickly the vaccine came out, or is it something else?
I think a big part of it is how quickly the vaccine came out, how quickly the vaccine came out, and how quickly it happened when a process that otherwise has, that we know historically has taken years. But this is also the first global pandemic where we had as close of global community as we do. Um, this is the first global pandemic where we had everybody, scientists from all over the world were working on the same thing. They're all working on the same thing. And again, we know a lot about this virus based on its genetic makeup that's very similar to many other diseases. Made it a little bit easier to kind of get a good running start on. So that was good. But you're right. I think people kind of look at healthcare workers as kind of the canary in the coal mine. Where
Hmm.
we're gonna be like, okay, let's get you guys vaccinated and see how that goes, and then we'll get the next group vaccinated as well. And I know for me as a nurse, I get calls all the time from all my non-nursing friends saying, "Hey," oh, even some of my nursing friends saying, "Hey, what are you going to do? Are you going to take this virus? Are you not going to take this vaccine? Are you going to take it? Are you going to not take it? Are you worried? Are you nervous?" And the answer was, "Of course, I'm going to take it because this is the right thing to do. This is the right thing to do. This is how we get our life back."
Hmm.
Is by getting as many people vaccinated as we possibly can, and that's going to take a while.
Absolutely. And um, I do not have the hesitancy to get the vaccine, and here's why. Because I am a military veteran, so they've shot me full of so much stuff. And if I was still active duty, they would definitely at some point force me to get it anyways. So if my brothers and sisters in arms who are still there, some people that I still love dearly, who still wear the uniform, are taking it, how can I sit there and say no? Now, don't get me
Yeah,
wrong. That's not doesn't mean I'm blindly align myself to anything they do, but this is one
yeah,
of those things where all the science supports it. We're talking
yeah.
about when we talk about how quickly it came out, it's like this. There's going to be a car released in a month. I guarantee you somebody knows how to paint it. You know why? Because they've been painting cars for years. Even though it's a
Exactly.
new car, it's not that new that they don't know what they're doing it.
It's a great analogy. It's a really great analogy.
I came up with it while you were talking about it. I don't know why it's cars and painting, but that's what stuck out in my head. But
But
uh,
but yeah, it's a great analogy, and that ultimately, yeah, yeah. I kind of brought it back to baking a cake. Is like, even if you're baking a cake, whether it's like a big, tall, pretty, complicated cake, or if it's a little small, cake, as long as that cake tastes good, that's yeah, like
yeah,
whatever. Yeah, really, really good analogy to be able to kind of just bring it back to. This is something we're all dealing with, and it's very similar to other things. Um, it's very similar to other viruses.
Mhm.
So that means that we know more about it than we did if we were just kind of getting started. So
A- And the other piece of that some people, which is funny, it's the chicken and the egg situation. I think a lot of times, but you're seeing now people use the reasoning that because some medical professionals don't want to get the vaccine, that
yeah,
they now don't want to get the vaccine because medical professionals are seen as if they're not doing it, then we shouldn't do it. But my thing is, medical professionals are people. So if you see something across the general population, you're going to probably see it in relatively similar numbers across any body of people. The same thing for military members. There's this thing that military members do X, Y, and Z, and yes, there's certain trends there and everything. But what you're going to see is their numbers will reflect the general population because that's where they come from. Medical professionals come from the same schools, they
yep,
come from the same neighborhoods that everybody else does. So if you have a belief in that populace, you're probably going to see something similar in the medical profession. Again, maybe at different numbers because of everything, but they're not immune to it, basically.
you're absolutely right. And the cross section of nurses across the gambit that have taken the vaccine so far, we're learning more about this vaccine even still. I mean, we're still learning.
Mm-hmm.
Um, and I think what we've determined is that the vaccine is safe. Like I said, no horns, no tail. And you know what? Afterwards, my arm was a little sore, but other than that, I felt pretty good. Felt pretty good. So, and that's less of a risk than risking exactly exactly the COVID-19 virus is going to do on its own. Because right now, what we know is we know that we know what all the initial signs and symptoms look like. What we don't know is 10 years from now, what's going to be the fallout from that?
Mm-hmm.
10 years, 5 years from now, what's still sticking? What's sticking? What's not sticking? And it's we got a long way to go before we get there, but we're gonna do that by getting people vaccinated and by getting as many as we can done. And healthcare is lucky enough to kind of lead that charge. And I think that's why healthcare is so critical to get out there and get vaccinated, show the public that it's safe, and be the trendsetters that we are, and be the leaders that we are.
Absolutely. And as I said, while I do not believe in taking away the freedom of choice from anyone in America, in medical health professionals in this case, I do think that there is a responsibility that you share there by, like you said, being the representation for people to go forward. Because guess what's going to
Absolutely.
happen? You're going to come and see the medical professional who did or didn't get the vaccine at some point
Yep.
if you do catch COVID-19. So you want them to be vaccinated against it to be able to provide you that level of care. Because guess what? If they get taken out by a vaccine, maybe they can't provide you the best care, and you're going to need that if you do end up
Absolutely.
getting it yourself.
You're absolutely right. You're 100% correct.
So,
It's one of those things where you're like, okay, we gotta we gotta be the ones to start this. We gotta be the ones to start this because we're gonna be the ones looking after everybody else once they're kind of working their way through.
absolutely. What we definitely need, here's what I will say this. If you're a medical professional or anyone in the populace for that matter who doesn't want to get the vaccine, that's your right. Do I agree with it? No, but I think that you're right, and I'm not gonna try to hold you down and
Agreed.
stick it in your arm. However, if you're like that person who I believe it was in Wisconsin or Minnesota or something like that, who is destroying cases of the vaccine. She it was like something like 40 or so, I don't remember what she did. She left it out of the
Yeah.
refrigerator on purpose. And then she admitted it too, which was ridiculous. So of course she's going to
Yeah.
jail. But
Yep.
don't do that. Because here's the
Yeah.
thing, don't take away other people's choice the same way that I'm not advocating for taking away your choice not to get it. But
Yeah.
don't destroy the
Absolutely.
vaccines. Don't go out there and try to start spreading these misinformation campaigns and things like that. It's a vaccine. If you're anti-vax, you're anti-vax. If you're not anti-vax, then you should not be anti this particular vaccine either.
Yeah. You're absolutely right. And I get people are going to be a lot more comfortable with this 1 year, 2 years, 3 years down the road when they've done those injections for a year, and we've gotten a lot of people vaccinated. We're going to really see a decrease in how this disease spreads, but we got a long way to go to get there.
Mhm. And that's my concern is that if we don't get the vaccination levels up relatively quickly, then those 1 or 2 years were going to look like 2020 did. And this is the
Yeah.
problem that I have again with that reasoning. And I'll get off my soapbox here in a second. But the problem that I have with that reasoning is that we spent most of 2020 trying to get back to normal life. And then people are like, all right, well, vaccine's how we do it. And they're like, great. And then they're like, hey, we get this vaccine. It's like, well, that was too fast. We expected to suffer, I guess, for more months through lockdowns and through everything else and
Yeah.
through skyrocketing cases. And it's like,
Yep.
you can't continue to do this. You have to at some point figure out what goes forward, you know?
Yeah. And I think the companies that have released the vaccines have done a pretty good job in doing that. They're basically saying, they're making the process as transparent as possible. They're trying to say, okay, here's where we are, here's what we know. Make an informed decision, which is what I'm all about. Like, people should be able to make an informed decision about what exactly they need, and nobody can tell you that but you. So it's kind of
Absolutely.
up to you.
Absolutely, and I think the other thing that's good news, I started to see that I think Johnson and Johnson is getting close to a one dose version of the vaccine is coming around
Yep.
that they may be getting approval in the coming months or something like that too. So I just say that to just say that just because we have two versions of the vaccine currently, we're not going to stop there. Also, I would imagine, I don't know this for certain, that Pfizer and Moderna are both looking at their vaccines and trying to get the efficacy up, trying to get it down to a single dose. They're still working on this. So what we have
Yep.
now is something that was effective enough and the stakes were high enough that we said, hey, let's get this out there. And so I would say, if you're worried about the vaccine, there's some concerns about everything. I understand that there's always risks. There's a lot of things. I understand that. But what you should be more worried about is that it's not effective, then it's going to actually hurt you. Because that's
Yeah.
the more likely outcome, is that it doesn't work.
Yeah. And that's going to be the thing. I mean, what I tell people all the time, my brother called me recently and said, hey, do I take this vaccine if it's offered to me? And I'm like, absolutely take the vaccine. Because one of the things I said was, um, you're either taking your chances on the vaccine or taking your chances on the disease. And we don't know enough about the disease long term, what that's going to mean, what that's going to look like. What we're finding is we're finding all these weird kind of symptomologies that happen with COVID that's more than just about their lungs. And that makes it, something that they got to kind of keep an eye on. So,
Absolutely. So I'm like I said, I'm cautiously optimistic that we're going to get there. I'm cautiously optimistic that that type of logic will start to reign because the fear that people have been exhibiting around these type of things and around what they believe they're being lied to at every turn when something doesn't naturally confirm with what they already believe or who they already believe. I think that's a dangerous road to go down, and I'm hopeful that people will start to take the left off that road.
absolutely. Absolutely. We certainly,
Wait,
you know,
real quick. Let me jump in real quick. I just want to say something.
yes.
I didn't mean left as in politically. You can take a right, a left. It was just an
Take a
analogy.
turn.
I
Just
don't.
take a
Yes,
turn.
exactly. I don't need people to start like just coming after me because I said left instead of turning right. It wasn't meant to say
Well,
turn towards Democrats or turn toward Republicans. Just it was a
yeah.
turn off the road that's taking you down the wrong path. That's all I'm saying.
What's funny is, and I'll get just this political because I know you're gonna have people on either side of the aisle,
Mm-hmm.
but the reality is we don't trust politicians with politics. Do we really want to trust them to be the most informed on health? And the reality is like, no. I mean, surely they know as much as they get to know, but ultimately we want to follow the science. Ultimately, we want to follow the science, follow the scientists, see what they're doing, see where they're going, and then follow that rather than follow somebody you voted for when in reality is they may not be someone who is up on science, and they may not be the most informed person in the room on what exactly is going on. And it's one of those things that when it became such a political firestorm, and it still is. I mean, it's still, I'm in Facebook groups that like you can't even mention vaccines because it gets so political, and that's unfortunate because the
Mm-hmm.
reality is the COVID virus doesn't care whether you're a Democrat or Republican. It doesn't care what side of the aisle you vote for. It doesn't care who you love or how you love them. It's going to affect everybody just the same, and that just the same is not meaning that every patient's going to have the same experience, because that's the other part of it too. Is some people are getting the COVID-19 virus and they don't even notice. They're like, oh wow, I had it. Holy cow, I had no idea. And other people are getting to the point where they're like, oh my God, you're going to put a breathing tube in me? holy smokes, this is really bad. And it's been everything in between.
Mhm. And that's, I think that's part of what allows people to run rampant with the misinformation, is that there isn't as reliable effects on people when they get COVID-19, because you, like you said, you see some people who have,
It's
they don't
far.
get anything. They didn't even notice. They just had to get a test for whatever thing they were doing, and they found out, oh, I've had it, and I'm almost done. Actually, probably I've got antibodies. I've already had it months ago, whatever it is. You
Yeah,
have those people, and because there is that, I think one of the things that, going back to the way that human beings process events, we're the hero in our story, so the hero can't get sick. And so that's a
absolutely.
problem that we all have, because we consistently don't believe we're the ones who are going to bear those effects of it, because, well, it's affecting old people and obese people. Well, I'm young and I'm in shape. He's like,
Yeah.
so that gives you a better chance. Doesn't give you a 100% non-chance. And
Yeah.
then also, to go further than that, I'm sure that you know someone who is in those categories, and you could spread it to them
Yep.
by not taking it seriously, or by not, getting a vaccine if that you have that opportunity. So I'm
Yeah.
hopeful, like I said, that the tide turns, and that we'll start to see some people start to come around to that. But like yourself, once I'm able to get the vaccine, I'll get the vaccine, because I want to go back to the gym. I want to go back and do some of the things I want to, still wearing a mask, still social distancing, but with the vaccine in tow.
And that's, and that's the hard piece too, is that people realize you're like, oh, okay, now that I got the vaccine, I don't need to wear a mask. No, we're not saying that. You still need
Mhm.
to wear a mask. You still got to do all those things you need to do, those socially responsible things to do. Is kind of a hard sell, but the reality is, if not for you, maybe you're going to prevent somebody else from getting the virus that may have been spread. Um, and 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 that's important too. And like people should want to do that. I know not everybody feels the same way, but it's okay. So it's been an interesting process how political an event this pandemic has become.
Well, I think that's going to carry forward. Again, I like to talk about politics more broadly than specifically to any particular incident, any particular person, because I think that's really how it's going to impact our lives going forward. And I think what you're seeing is
Absolutely.
that, who's the person that needs to convince you that politics are a big deal? Politicians, because that's what they do for a living. That's everything they do. So every chance they can, they'll make something political to either gain support from the people they already have, or to try to bring somebody over to them, because suddenly they go, well, if he believes this one thing I believe, maybe I can get other things. So they're turning a lot more issues into political issues that aren't. These simply
Absolutely.
have no bearing on politics, but they're convincing you that they do, so they can either further align you with them, or to bring new people into the fold. And so you have to
Absolutely
sit
right.
there and think for yourself on these matters, because again, there are politicians that I agree with on some things, that I don't agree with on others. And no matter what, if they came in to me and told me that the sky was yellow, I'm not going to suddenly start to question it. I'm not
Yeah.
going to suddenly start to change my beliefs based upon whatever tribe has said this is the fact.
Yep. You're absolutely right. And I think that independent thinking is so important to be able to kind of, but look at the evidence. Look at what the evidence has for us so far. So
Yeah, well, that's the problem now, because here's what I would really want to get into down the line. With these individuals who have say these type of things, it's like, if you
yeah,
say that the press today, the media today, or politicians, or whoever it is you're accusing of lying, right? You're saying that they're lying. Don't you believe they've been doing that through history? So why do you believe anything you believe? Why would you
it's,
believe the history books are factual? Because
it's a
those
good
are written
question.
again by the same people. So
It's a
you're
good
saying that
question.
anything can be false, that you choose what to believe, then you don't believe in anything. You just
Yep.
believe in whatever feels good. That's
Yep.
confirmation bias 101.
100% confirmation bias, and we all do it. Like
Mhm.
for me, it was an easy call to decide to get vaccinated, and then I started having conversations with my friends and people that were in the same industry as me, and then the more I was thinking to myself, like, yeah, this just makes sense.
Mhm.
Like this is the right thing to do. So
Absolutely. So, like, the reason that you saw me wearing something one day that looked really stupid, that's confirmation bias. I thought it was good. I thought I knew what I was doing. So,
yep,
if you
absolutely
think I
right.
look stupid wearing capris, which I've worn before, very baggy, stupid capris way back when, then that's your own confirmation bias for whatever it is it's facing you. We all have to challenge our own beliefs and go
Yep.
to places where it doesn't feel good to read things you don't agree with. Keep that
Yeah.
in your circle, and I think that'll help you, like you said, be a better independent thinker. I'm hopeful that we'll get there.
And it's a good skill to have, to be able to kind of critically think and think things through. Like it's a
Absolutely,
great skill to have.
absolutely.
So.
So if people want to follow your process of growing horns, a tail, turning
Yeah.
into whatever the vaccine is going to turn you into, or to see you further shill for the Illuminati, as I'm sure you are, where can they find you? Tell them all the places they can come find you later.
Sure. You can find me at the Art of Emergency Nursing podcast. I podcast about emergency nursing. My guests are all emergency nurses, and we talk about some topics like COVID-19. But it's really an interview show where really we get a chance to just sit down and tell nurse stories, which tend to be a lot of fun, sometimes a little irreverent, but always informative. So that's kind of what I do. You can follow me there on social media, the usual places, Instagram, Facebook, all those places, Twitter. I don't do much on Twitter, but they can certainly follow me there and see if I grow a tail. Like I don't think so far. I got my second dose a week ago today, as a matter of fact, a week ago today, and doing okay. Like I was lucky, and now I'll tell you that people who got their second dose, it was kind of rough. Their body had what I try to remind them. When some of the people were saying, "Hey, I got sick from the second dose of vaccine," I'm like, your body had a robust immune response. Like it did exactly what you wanted it to do. And that's exactly what it did. So their body did what it was supposed to do. So
So to go back to one thing you said earlier there, just on that last point, the flu vaccine does it to people too.
yeah. Like I got my flu vaccine. So I don't know if you get the flu shot every year, but every year I get the flu shot, and I always put it off as late as I can because I want it to last through the coldest months here in Houston, Texas.
Mhm.
So I got mine pretty late, and every time I get a flu vaccine, like the next day, I feel kind of crummy. Like I don't feel like it. I don't really feel great. Sometimes I maybe have just kind of a low grade fever. Sometimes I just feel kind of under the weather. And that's your body having an immune response. That's your body building those antibodies to that vaccine or to that invader, the flu. And the same thing's true with this. The vaccine, I think, it's probably about 50-50 for my friends on people who either didn't feel great after the second shot or felt fine. I was lucky that I felt fine after the second shot, but one of my couple of my work friends were not quite as lucky. They didn't feel too good. They felt kind of puny. Um, but what we all knew is that it's gonna then hopefully, you know, knock on wood, we're going to be about 95% resistant to this virus, which is important to me. So
Outstanding. So the one thing I want you to relatively certainly promise is that if it does start to affect you in some kind of negative way, that'll be part of your podcast as well. I imagine you're going to be talking about how you feel because that's going to be part of the
yeah,
topics, right?
yeah, for sure. Like if I had a really crummy response to it, like I'd be upfront with that, and I kind of committed that to my audience. Said one way or another, whether it goes well or if it goes terrible, I'm gonna let you know because I'm just kind of here to report it. And so sure enough, some of my friends have had kind of not so great response, and I've been real upfront with it. I had a friend, one of my nurse friends, asked me today. She's like, "Oh gosh, I'm thinking, do I want to do this?" And I told her, I said, even with the people who didn't feel good after the second shot, which is when you're most likely not to feel good because your body's building the best immune response. Then, even if you ask them, they still say it's worth it. They still
Yeah,
say it's worth it because even the folks that I know who've had COVID have said you don't want COVID, and that's for sure. So
absolutely agree. So, well, thank you very much, sir, for coming on here and sharing your story and sharing your wisdom. I will definitely make sure that I link in the notes to this where they can find you. And hopefully, like I said, we'll follow you either as you turn into a demon that the vaccine did or watch you shill for the Illuminati, whatever the outcome is. But definitely thank you so much for coming on here and sharing your knowledge and your stories.
Brandon, thank you so much for the opportunity to be on your podcast and get a chance to share my story. I appreciate it. I
A-
appreciate you taking the time to talk to me.
Absolutely. So, thank you very much.
Thank you.
Thanks for checking out Starting Nowhere. Check us out on Facebook, Twitter, or Instagram if you want to see more and interact with us on any of the things you thought about this or other episodes.